Let's start with an easy one. What should everyone eat?
More plants.
Oh, more plants. Okay. Good to know. Good, bad, and everything in between. The food we eat changes our lives and the land around us. Learn and be inspired by stories of food, people, and the land we all share as we explore how food transforms. Let food be thy medicine and thy medicine be thy food is a quote attributed to the Greek physician Hippocrates from around 2,500 years ago, and that informs a phrase you may have been hearing of late, food as medicine. This is Alex McKiernan of Robinette Farms coming to you on the sidelines of a conference on local and regional food at the University of Nebraska's Innovation Campus. I know that in my life, if I have energy and focus and some level of commitment to my day, the food I eat, the things I consume, they play a leading role in that success. And of course, long-term health is deeply affected by what we choose to put in our bodies. My guest today grew up on a farm like Robinette and is now on the front lines of applying these food as medicine ideas because she is both a professor at the University of Nebraska Medical Center and a real live doctor who treats patients every day. Dr. Stephanie Hartman is board certified in internal medicine and she works with Nebraska Medicine as a primary care doc. She aspires to prevent and reverse diet-related chronic illness with an emphasis on improving food and nutrition for her patients. To that end, she has involved herself in a plethora of community and professional organizations and won many awards along the way. Now, I could list all of those, and I could tell you all the sorts of great sciencey things that she has done. But what I noticed when Googling was what her patients, I didn't have Googles on your parents' comments, but I do on your patients' comments online. Here's some of what I found. Good, very good, wonderful, smart doctor. I like her a lot. She listens. Fantastic. I am so grateful to be under her care. Dr. Hartman is thorough, treats me with considerations, and listens to my questions and concerns. She cares about me as a person, not just a file on her desk. She's the best doctor I've ever had. She was responsible for my timely cancer diagnosis at age 44, for which I'm always grateful. Dr. Hartman, welcome to Food Transforms.
Thank you. Thanks for starting with that. That was warms
Isn't
my
that kind of what you want, right?
It's
It's
nice.
like it's nice to do science and have awards and stuff, but you started this to help people, right?
Yeah, and it's just gratifying to know that, the time that you spend with someone matters to them.
Well, and that was, I read, I don't know here, 8 of them, and you've probably looked. Maybe you haven't. Perhaps you're too Midwest humble to do so, but all of them are amazing. They're all like beautiful testaments to the work you do. So kudos. That's awesome. Let's start with an easy one. What should everyone eat?
More plants.
Oh, more plants. Okay. Good to know. There are so many diets out there. It's really hard for people to know. Like they hear from someone this worked and someone this worked. So in general, more plants. That's your advice?
Yes. I think the idea that we would have a diet or some of the things that maybe come across as fads isn't super helpful because it distracts from the fact that we should probably just all eat more whole foods, and most of them should be plants.
Okay. We first met earlier this year at the Nebraska Sustainable Ag Society conference, where you gave an excellent keynote address. Super informative. I love graphs, and you had lots of great graphs. But you also made that science accessible to everyone, not just the nerds like me. And so it was an excellent presentation. You talked about overweight patients that you've seen who are actually malnourished. I don't know if that's exactly the right word to use, but they were essentially eating plenty of calories or even too many calories. But in a way, they were starving because they had nutrient deficiencies.
Yeah.
They were overfed and undernourished. How is that possible?
I think part of it is where you're going to get your foods, where you're sourcing your food from, what types of food you're eating, and some of the foods that are accessible to people that are, typically more processed or fall into that highly processed. They're really calorie dense, but they are not necessarily nutrient dense. And if that's what you fill up on and you don't have fruits and vegetables and, appropriate amounts of dairy and protein and fiber, which I'm sure we'll get into.
Oh, we're going to talk about
those, you have a hard time covering those like trace minerals, you know, vitamin, all of those needs.
Right.
And yeah, unfortunately, people can be iron deficient or have low vitamin D or low B12. And some of that, to be honest, may play into medications that they might be on.
Mm-hmm.
But some of it is in people that don't take any other medications, and they're just not getting the diversity they need in their diet.
Right. We talk a lot about obesity, but I know plenty of skinny folks that don't, quote unquote, eat well, right? Nutrient deficiencies must be common regardless of body weight, I would think. How pervasive are nutritional deficiencies you see in your practice? Does it track with body weight, or is it everybody?
You know, I think they could be identified in anybody.
Yeah.
Some of that might have to do with some other chronic disease that someone has.
Mm-hmm.
And that's certainly, you know, when I was aspiring to be a physician, I thought that those were the people that I would mostly see, to be honest.
Mm-hmm.
I would take care of people that had some sort of, you know, change in their genetics or a predisposition to something that might make them, you know, more likely to need my care. And that is not what I've turned out to do as much.
Really?
Because I think we have much more burden of what we consider like chronic, more diet-related diseases, diabetes, hypertension, you know, those type of things that we spend a lot of time taking care of now.
And what are the common nutrient deficiencies or diet-related things that you do see? Like, how are they related to diet?
Can you repeat this question?
Yeah,
so
I didn't ask a very good question. That's, it helps if you ask the interview subject a question that makes enough sense that they could answer it. That's what I found.
I think I just need to think about it again.
No, I think, what are the common nutrient deficiencies you see?
I would say most commonly it's either like iron deficiency, vitamin D, like I mentioned earlier, and B12. Those are probably the more common. You know, there was a period of time around COVID when people were taking a lot of zinc, and we'll get into the nerd weeds here. Zinc competes with copper in absorption, and so we did have some incidents of copper deficiency. So you can overdose on vitamins, which is the other reason I don't, you know, recommend that everybody necessarily needs a supplement either. But I would say those are the kind of the top three that I see.
Right.
As far as deficiency.
Does that lack of nutrition exist across the socioeconomic spectrum?
I don't know as far as like data on that, like right off the top of my head, to be honest. I think there are certain populations that have difficulty with food access, and they're going to be more likely to have, you know, risk for deficiency. So like the dietary guidelines, the recommended, you know, dietary intake for certain things were set at a level to prevent, you know, deficiency.
Right.
And if you have low food access, and a lot of those people supplement with sort of the calorie dense things, they're going to be at more risk.
And those the vitamin D, iron, and what's the
B12.
one? B12. Thank you. Are those easy to come by just with eating more fruits and vegetables, or is that why you say more plants?
So B12 is only available from animal products.
Okay.
B12 has a kind of finicky absorption. It needs a cofactor in your gut. And so this is where if you're not, if you have some other altered absorption, it might be hard for you to absorb B12. Sometimes that B12 absorption changes as people get older too.
So in addition, I mean, the B12 is coming from animals, but in order for your body to make use of it, you need these cofactors. Yeah. And I imagine we'll get into those. This might be where we're headed. You mentioned in your presentation that protein is a big buzzword today, and people are very focused on it. But you joked and you said, I'm on team fiber. my family wants me to get a t-shirt that says Team Fiber. Why are you on Team Fiber? Does that have something to do with the cofactors, or is that separate?
Fiber is what feeds the microbiome of your gut, for one. And so some of these nutrient deficiencies may stem from like altered absorption in the gut.
Right.
And I will say, I'm going to say strongly, I guess, the word may, because I think this is like an emerging area of science, is the microbiome of our own guts.
And that was a question I had, is your gut biome is really influenced by the fiber.
Yes.
More fiber means a
Yeah.
healthier gut biome.
Yeah.
And we hear that word a lot, but what is a gut biome and why do I need one?
Well, mostly because those microbes in your gut, so the bacteria.
These are other living organisms,
Yes.
very small, that live inside
that live inside your gut and
Yeah.
help you break down your food so that it gets presented to your gut lining,
Yeah.
so that it gets absorbed and can be used by you.
Wow.
And when that is not in balance, I mean, that's can contribute to lots of like disorder, or dysfunction or dysbiosis, whatever word you want to use. And that can influence how efficient you are at absorbing all of these things. Not just the ones I mentioned, but like everything, basically. And, certain things get absorbed along your whole GI tract.
Mm-hmm.
And so you need that whole thing to be healthy, because if one part of it is off, then you're, at risk of not absorbing the things that need to come in at that space, if that makes sense.
When you say you're on Team Fiber, the more you feed fiber into your body, the healthier, ideally, your gut biome is, and then your body is able to absorb things from animal products and all the other foods you're eating that without the fiber and without the healthy gut biome just may not happen.
Yeah. I mean, so that's one thing. The
Yeah.
other reason I'm on Team Fiber,
Team Fiber.
is, it promotes satiety, or the feeling of being full.
Feeling of being full, satiation.
Yeah.
Satiety, is that the
Yes.
scientific term?
Yep.
Okay, you taught me something.
And so you would eat less the longer you feel full.
Yeah.
So that is important for weight management. People don't, well, I won't say people don't typically eat when they don't feel hungry, but if you don't feel hungry, it is a barrier for some people to eat.
Right.
So that's, important part of that. It also influences cholesterol absorption and your glucose absorption.
Mhm.
And so it can help with chronic disease prevention because of, the sort of process of absorbing those, or actually making some of it just travel through your gut without being absorbed, which is also important. So we don't want to absorb everything.
Yeah, right.
Especially if your diet is, really high in something that you don't want to have.
So where are the best places to get fiber? Like, you say fiber and people think Metamucil. It's like, maybe that's where you get fiber, but where is the best place for people to get fiber in an enjoyable way? Because no knocks on Metamucil, but
yeah,
that's
I
not
mean,
how
if you need to supplement like by putting in like a, Metamucil type product, then that's okay, I guess. I think fiber from food, not everybody would agree that these are enjoyable, probably, but so that might be up for debate. But like lentils, beans, lots of vegetables like have fruits have good fiber in them. I think the plants are by far going to be the place where berries are especially high in fiber for the amount of like volume that they are, and for the calorie density.
Blueberries, raspberries,
strawberries, yep, all of those. Oats, so like whole grains. So the more that the grain looked like when it got harvested,
right,
the better.
Nuts.
Because you've kept all of the structure to it. To keep all the fiber.
Is that like wheat germ? I feel like growing up, my mom would put wheat germ or something on her cereal, and we'd call it sawdust.
Yeah, It's also the other sawdust would be like ground flaxseed that has fiber, chia seeds,
Right.
tons of fiber.
Well, when I heard you present about chia, and I like chia seeds, but I didn't realize they were so fiber rich, and I've really added more of those into my diet. You mentioned in that presentation that environment, not genetics, determines your gut biome. I found that really interesting because I feel like we talk a lot about genetics these days, and sometimes it kind of feels like, well, it's out of my control. But what do you mean by environment, not genetics, determines your gut biome?
Well, I think, so specific to that presentation, the data that I was presenting was studies looking at people that had a similar ethnic background. No, they had actually diverse ethnic backgrounds in that group.
Mm-hmm.
And then, but they all lived in a similar environment.
Right.
And that is where they matched up like their microbiome. So then if you looked at their relatives living in a different, space and environment, even though genetically they're very similar,
right,
their microbiome was very different.
Was tracking where they lived and their diet, I assume.
So probably related both to diet. There was 2 studies that I presented there, and one of them was urban and rural comparison. So one of the things is probably diet. The other could be like proximity to animals, agriculture, how much you touch grass, I guess, if you will.
Right.
And then the other part being your diet.
So I'm at this local food conference, and I'm going to ask people some questions here.
Are you recording?
I'm recording, yeah.
For what?
We have a podcast.
Oh, it's your podcast?
Yeah.
Okay, great.
Yeah. It's recording right now. What food makes you feel the best? Like, what food do you feel most like yourself when you eat?
Squash.
I like squash.
Any variety of squash. Like anything that is in that gourd family.
It has to be a gourd, though. We're going across the table here.
Asparagus.
Interesting. Okay. It can also be a meal, So, like, is there a meal that you're like, oh, my God, this makes me feel alive? I'm not putting that on the podcast.
I'll say a really good salad.
I'm with you. I think if I could have a salad that had, like, wintered over spinach, really thick, juicy greens, and some nuts and cheese and steak and vinaigrette.
Yeah, add the steak to it and then...
Steak salad, you're sold. Tim.
Good morning.
What food makes you feel the most like Tim?
Probably kale, because I don't really like it.
This is interesting. This is a whole emotional personality question.
I can talk more about this, okay? Like this, I also don't care for...
You can talk more about a lot of things, Tim. Hello, sir.
How are you?
I'm good. How are you doing? This is a microphone that's recording our voices.
Oh, no.
What food makes you feel the most alive?
Goodness, it depends on the day and the time. Okay, pastured broilers comes to mind. Some just really good, yummy, homegrown chicken.
I like it. That's a good answer. Wait, but you got to tell me.
No, don't answer me.
What food? What? No, get over here. What? You don't have to say your name. Nobody knows who you are. What food makes you feel most like yourself, most alive?
Grass-fed beef.
I'm going to go with the white strawberry that I grow, a perennial strawberry. I can't remember the name of it.
Because the white ones mean they're not ready yet, right?
No, it's like a white yellow when it's ready.
I would like to
What?
introduce you.
Oh, yeah, please. I am Alex. Well, I'm trying to interview people, and I'm just, some people want, hold on. I'm trying, yes, of course, the red light's on. You're just ruining my podcast. What food makes you feel most alive and like yourself?
Anything my mom makes.
Oh, that's good.
Yeah.
Don't look at her. this is a question for you.
I've hit a wall and all I can think is beer.
I'm a bread guy. I love bread.
Gluten, okay.
When I have a fresh tomato, I feel so happy.
Morel mushrooms for sure.
What food makes you feel most alive?
Fennel.
Fennel?
Yeah.
No one has answered fennel yet.
Okay. All right. Good job.
Okay, sir.
Kohlrabi.
Okay, so you're German.
I like Brussels sprouts.
Wow, we got all kinds of Germans here, don't we? The interview's over, you guys.
All right.
You did great.
Thanks. I get an A?
We'll talk about that. Yeah. We are back with Dr. Stephanie Hartman, who was characterized by one of her patients as, quote, the most compassionate, intelligent physician I have ever experienced. That's wonderful. There were so many comments about you being a good listener. And like, that's what you want in a doctor, right? Someone
That's
who
what
hears you
I
out.
want in a doctor.
Well, I think you want the same things as your patients. Have you ever read these reviews? Do you go and read them?
So I am fortunate that I actually am in a health system where we have like a person that sends these nice comments to us.
Great.
And so I do read some of them.
I mean, if you need to pick me up, just go look at your website because it's pretty nice stuff. So we're at this food system conference, sitting on the sidelines, people hearing conversations going on in the elevator and people walking by. I'm wondering, wouldn't a lot of people say, what's wrong with our current food system? I mean, there's countless grocery stores all over the country. 24/7, you can usually find a grocery store somewhere that has nearly all the food you would want. Why? People who aren't in this community or in farming or in food sales or public health related to diet, wouldn't they look at this and say, there's nothing wrong with our food system? What is wrong with our food system?
I mean, we just spent a whole day at a conference sort of hashing this out, so there's probably a lot of answers.
I mean, can you make it a nugget for someone who's a non-believer and saying, well, I can go to the store and get what I want. That's what I want from my food system.
Yeah. I think what that leaves behind is there is a fairly big population in Nebraska that can't go to the store and get whatever they want because they don't have enough money or access. And that overlaps with a high-risk population for chronic disease. And that's kind of, I guess, part of the problem that I see, and it motivates my participation in like a discussion like this and an awareness.
And if folks are in that position where they can't afford the food that they need, especially if they have chronic health issues, and they can't stay healthy and participate in society and hold down a job, and those are costs that end up accruing to society as a whole at some point.
Yeah, absolutely.
That's part of what we're talking about in food systems.
Yeah. No, I mean, I think, so that's one of the things that I see that is an issue with the food system. And then I'm not sure that I always make the healthy choice the easiest choice for everyone. And because of the like just sort of convenience factor really makes the nutrient or the less nutrient dense and high calorie dense foods like the easiest things to choose. And when we're a busy, society, that seems to win.
Well, you're speaking my language here. I mean, Chloe and I spend a lot of our time, I feel like we're farmers, we raise livestock, but it really seems like what our job needs to be is to get people to change their behavior, which is hard to do because cooking food, making an extra stop to get your box of food that you buy from us is an extra stop. And it's one more thing that you got to do on your list. It's not very convenient on top of having to cook it, et cetera.
Yeah.
So first part of the conversation, we really discussed the lack of nutrition. I'd really like to get to the point where you can talk about how food can help you transform in some way and improve. What foods best address the most common nutrient deficiencies? fiber is one big area you talked about, and more plants.
Yeah.
How quickly, if someone can do those things and get them into their diet, how quickly can they expect to see a change in their life? Is that days, weeks, years?
I think, I am like talking to people about behavior change and what their capacity is for behavior change all the time in my office. I mean, that is a lot of what I'm doing. And so I think it depends on how much is incorporated, how fast. But for most people, like huge change and that being sustainable is just not possible. Possible. And so I think what we have to settle on is that you have to be okay with knowing that most of us have the capacity to make like a small change.
Small changes.
And then be okay with the fact that there's not going to be like this enormous like feedback initially, you know? And so, if you say we'll use fiber because, that's...
You're on Team Fiber.
I'm on Team Fiber.
I'm on Team Water, by the way. I don't know if like that's a thing, but my children come to me and they're upset in some way. I say, did you drink some water?
Yeah.
Like so I'm Team Water, I feel like. That's
a glass of cold water can solve a lot of problems. I agree with that. It also helps with fiber digestion.
Okay, so it goes along with Team Fiber. But so I interrupted you.
No, that's okay. But say, the average American diet, we're probably getting 10 to 12 grams of fiber at best a day. I kind of wish I could look this up as an actual statistic, but it's around there.
Okay. And we want to be at
25 to 35 grams.
So 2 to 3 times as much as we're getting is what where we
and
need
if
to
you
be.
look at like indigenous population, like anthropologically, people were getting in the hundreds of grams. So we're way away from, from what our ancestors were eating.
Yeah.
But number one, you don't want to go too fast on increasing your fiber, because if you're getting 10 grams and then the next day you go to 30 grams, you're going to feel that in the
Your body's not used to it.
No.
Yeah.
And you're going to be gassy. And people around you might notice that.
Right.
So
they notice it.
So incremental increase. Say you just focus on adding 5 grams for the next month and then 5 more grams or whatever seems manageable. I think you will notice that over time. And then once you are solid on a habit, then you choose another thing that seems manageable.
Right.
So recommendation is to get 5 servings of fruits and vegetables, in your diet a day. When you looked at the kind of older previous MyPlate recommendation from the dietary food guidelines, if you look at what you're eating in a week and you realize that you're at best getting 1 serving a day of a fruit or a vegetable, then just try to add 1 more in.
Right.
So I think the idea that we need to go from eating whatever we were, just whatever, to something that is really on point and is not realistic. And I don't really want people to have that expectation for themselves, because that is when people just say this doesn't matter, that nothing's changing.
This doesn't work for me.
It doesn't work
too
for
hard.
me.
It's like small habits.
Yeah.
Start small and add them in. That makes sense.
And if you're doing no food prep, then maybe you put 1 day out of the next month that you do food prep.
Right.
And that you probably ate better for, 3 or 4 days out of the month if you did that.
That's something.
Yeah.
It's something. And I suppose if people make those small changes and they feel differently, that's real positive feedback to continue or expand that, right?
Yeah.
As opposed to going full bore, feeling terrible because your body's not used to that, and then saying, well, that didn't work.
Yeah.
That's a negative reinforcement.
Yeah. And I think not really, I guess if you have a really high sugar intake and you don't tackle that, but you try to add in the fiber, you may not feel as good as if you lowered your sugar intake. So that's where it's helpful to have somebody that's professional maybe to help you look at what you're eating and tackle the things that like might be interfering with your feeling good the most.
Right. I'm reading about these Fresh RX programs. There's Oklahoma, there's some in Florida, Kansas City. I'm sure they're all over the place. What do you know about these Fresh RX programs? Can they show that health outcomes are improving?
Yeah, so the Fresh RX in Oklahoma is an intervention that's in a patient population that have diabetes, and their goal is to bring people into better control of their diabetes by intervening with CSA boxes of produce.
So like just a subscription kind of model from a farm or from a group of farms where they're
Yep.
getting
Yeah.
vegetables, produce, whatever, weekly.
Exactly. So they collate those, produce into they're getting it every other week, and then every week there is some sort of educational opportunity for the people that are, participating in that intervention. It's a 12-month, so this is a really meaningful intervention. I think that's the other thing when you're talking about helping people with lifestyle change and behavior change. 8 weeks is not really enough. Yeah, and so that's the nice thing about that program in Oklahoma. And they have shown meaningful change in diabetes, metrics, which would be like the A1C. They've had really meaningful weight loss in that, even though that wasn't like necessarily the top goal. When those people were eating a more plant-forward diet, that was true. And there are lots of those programs, like you said, across the US. And I think the education piece is really important because those people are getting like instruction on how to prepare that food. They're getting lots of knowledge about resources in their community, because the intersection of people that maybe don't have the knowledge on the nutrition with the people that don't have transportation or need other services, those are all kind of combined into those programs. And
that's cool. I've heard about them, and it's neat to see that it sounds like they're working and that they're long enough for people to work. On the education front, you mentioned that research has shown that people eat more fruits and more vegetables when they participate in growing the food, which I thought was really cool. Not only does eating the food transform you physiologically, but I think your mindset about any food in front of you changes when you cultivate it.
Yeah. I dove into that community gardening research and was like fascinated that like the people that participated in that and their household. So even if all the people in the household weren't going to participate, they still benefited from having one family member go into that community garden.
That family member brought home the excitement and the joy.
Yeah, and the whole family ate more fruits and vegetables.
Well, they're not going to not eat the food their kid helped grow, right?
Yeah.
I mean, there's some peer pressure there that's pretty powerful.
That's probably true, but I think it makes sense to me. Like I grew up. My parents had an enormous garden, and we actually rarely bought produce when I was younger. And I ate a lot of produce like as a kid out of that garden. And I think that if you see the whole process, like it just exposes you to stuff that you don't otherwise see.
Yeah. Do you prescribe gardening to your patients?
No, but I probably should.
We'll come back to it.
I have, yeah.
I mean, it's one of those things that wouldn't that be cool if you could? If you say, hey, listen, do you have 2 hours a week? There's a gardening group you can meet, and you'll take some food home with you.
I do have patients that are participating in those endeavors, but it's not necessarily because I recommended it. It's because they're community-minded in that way.
Well, and because you listen so well that you pick up all the options they have available to them, help them find their way to it.
Yeah, I mean, in that way, that is just the coaching aspect of, of what I do.
Right.
Like, I don't find it to be super effective to lay down like
That's interesting. That's a different, you don't hear about doctors as coaches, which is a more supportive role. And I think, Chloe's a much better parent than I am oftentimes because she's like, we need to help them, our children, figure this out on their own, as opposed to you just telling them, don't do that.
Mm-hmm.
We need to help them figure out ways that they are motivated to make that change. And I think that's more of a coaching role than a prescriptive doctor role.
Yeah, I mean, I think, so in the healthcare kind of training, so the students that I work with, we do spend time teaching them like motivational interviewing, which is, I think of as more of a coach. So it's like, what do you see as the capacity for you to change? If this is what is going to bring you better health, like how do we move the needle? We've been talking all day about moving the needle for change, but like I don't, I think the old, more paternalistic part of medicine was like the prescription, like here's what you do, but that's just not where we're at. And you need to have buy-in for people to like.
Well, and ultimately, like we talked about before, a lot of these things are about managing behavior and not necessarily fixing or taking a pill, and it's like this is going to be something you manage in an ongoing way. Today was a great discussion with a whole lot of people about food, farming, getting food where it needs to go, and to the people who need it. And these are conversations that are happening all over the country right now. There's even significant federal funding towards these sort of food as medicine ideas, at least in rural areas. What excited you most today?
I get a lot of energy. I mean, I think it is like underrated as to how much energy it takes to do a lot of thinking for the day. So we asked people to do a ton of thinking and sharing, and I think people left pretty tired about it. I felt like the room had so much potential, and I'm very excited that people can see a vision for something better than maybe what we're living in right now, and that pretty much everybody was like willing to like get on board with an action item and like meet up again. Like I didn't see anybody who was like, oh yeah, I'm out of here. Here's our meeting. And I'm not sure how many people I gave my like email out to. And I just think that's really, this community sort of caring about this is really exciting.
Food transforms everything around us. If you like what you heard today, please subscribe, post glowing reviews, and tell your friends. Visit robinettefarms.com today for food and info. Join us next time, and remember, food is a gift. Enjoy it.
Probably potatoes. I think potatoes are just so reassuring. Okay, I mean they just they're fortifying. You can do anything you want with them and all this and so forth, and they keep. Okay, so it isn't like they are fresh produce, but they got some staying power. All right, and that's what we're looking for.